morning and welcome to another episode of Hatching for Health with your host, Jessica Hatch. We hope you have had a wonderful weekend and having a wonderful Tuesday evening. Tonight, we're going to be joined by Dr. Fred Aguilar. Now, he is a plastic surgeon as well as someone who does reconstructive and ENT surgery. He's right here in the Houston area, and he is a part of Houston Plastic and Reconstructive Surgery Group, and good friend of mine, and luckily we're going to have him on the show. So welcome, Dr. Aguilar.
Jessica, thank you very much for having me on. It's a great honor to be here.
Yeah, I'm excited. It wasn't here in the studio, but it's just as good to be able to connect one-on-one, with a doctor here in Houston that we know can help many patients around the area, whether it's plastic needs or just something more relative to fixing a concern they've had all their life. So I know that you predominantly work with adults, but I also know that you have a lot of experience with what surgeries that children may undertake at a young age, really as it relates to things like their ears, protruding out, larger than they would typically want to grow up with, as well as some of the rhinoplasty surgeries. So I want you to kind of talk a little bit about your practice first, but I just wanted to give the viewers a little scope of what will come as the episode proceeds.
Jessica, thank you very much. Just as a prelude to all your viewers, I grew up in Houston doing all plastic and reconstructive surgery, and in 1992 I won the Jefferson Award for the work I did for children who were born without ears. And I reconstructed an ear for them in a series of 4 operations, and I worked with another doctor and we gave them an eardrum and hearing. Unfortunately, over the years I've shied away from that, mostly because many of the children that we see don't have good insurance coverage, and it was better handled by someone in a large metropolitan health complex. So in private practice, I've tended more towards children that have deformities of the ears that are congenital in nature. For instance, an ear that sticks out too far. Kids get mercilessly kidded about that starting at age 5, 6, and 7. Even when they enter kindergarten, other kids make fun of them for their ears that are sticking out. Also, I do children, young adults, maybe children is the better word, that are ages 12 to 16 that can't breathe out of their nose. They got hit playing soccer, or there's an abnormality on the inside of the nose. And we're going to talk about both of those things today. But I do have a lot of experience with children.
Yeah, and it's great to learn that. I know we didn't get into too much detail outside of your adult, the patients that you see on that side. So that's actually new information to me, and very exciting to know. I'm sure there'll probably be children that we're able to connect you with that you'll be able to help. So this was something, when these surgeries were taking place, was it in the medical center, or was that a private surgical center?
No, I was in the medical center when I was doing those surgeries. I was at the University of Texas Health Science Center in the Department of Plastic Surgery and the Division of Otolaryngology and Head and Neck Surgery. I had faculty positions at the time. I still have clinical appointments at these institutions, but I'm more in private practice now. So it's more difficult to do pro bono cases in this current climate.
Of course. But just that must have been so rewarding. You're talking about a child or baby born with actually no ears or the capability to hear at all, and y'all were going in and physically creating that for them.
That's correct. It's really a transformational surgery because these children are very introverted. They know they're different from the other kids. It's been pointed out for years to them. So when we do that first surgery, they come out and they're beaming because they can actually see an ear now on the side of their head that they didn't have before they went to sleep in the operating room. So it's a very dramatic, life-changing surgery.
I couldn't even imagine. And this is done, is it right at birth? Or it sounds like maybe they have to be a year or two old.
Yeah, that's a very good point. We don't operate on them when they're young because one of the steps, the very first step, is we actually take part of their rib cartilage out, and then I'll go to a back table and we'll carve and sculpt a framework that looks like an ear. So the child has to be about 6 years of age or 7 years of age to give us enough cartilage to do the work. Also, at that age, the ear is already 95% of adult size. So when you reconstruct the ear, you're matching it to the opposite side, which is usually grown normally.
Okay.
And so it's an easier time to match both ears. So there's a lot of pluses about
Yeah.
doing them at age 6 or 7. And every child from then on, every 3 to 4 months gets another surgery to
Either
finally get
way.
the ear looking the way we want it to.
Okay. Is it common that they're born with both of them having, the lack of the necessary things that most people are born with, or is it?
Yes, it's actually
Okay.
surprisingly common. One-sided problem is 1 in every 6,000 births in the United States alone. We estimate that to be roughly 1,000 new births every year in the United States.
Hmm.
The kids that have both sides affected are usually about 20% of that number. And the condition is called congenital microtia and atresia. And the microtia means a very small ear or non-existent ear. And the atresia refers to the fact that they have no external auditory canal, and therefore they can't hear normally. They have no eardrum. And the ossicles that we all learned about as kids, the
Mm-hmm.
hammer, the stirrups, uh, are all encased in bone. So they're not working for them at that moment.
Oh, that must have been incredibly rewarding. And 1992, so this must have been somewhat earlier on in practicing.
That's correct. I started in 1985 with this kind of work and developed it over the next 15 to 20 years. So
Mm.
it was very intensive for a long period of time. And I think I must have done close to 1,000 children in those years that I did
Oh
it.
my
And
gosh, that's
that's a significant difference. One,
it.
one of the interesting things, just as a side story, is my very first patient was 10 years old when I did him.
Okay.
And he came back at age 22 and he came into my office and I said, "What are you here for?" And surprisingly, he brought his wife for cosmetic surgery. And that was really humbling.
I bet. Yeah, really. It's like, let's go to the guy that, yeah, made me
Yeah,
whole when I was a young boy. That is really
exactly.
humbling. Yeah, to someone
It
to
is.
come back years later and have that trust factor there. So
That's
you started. So your residency was strictly plastics, or was it actually ENT first? What subspecialty did you
I
get?
actually did I actually did the ENT first, and then I did a year in facial plastic fellowship also under ENT. So I got my boards by the American Board of Otolaryngology, and then I got my boards by the American Board of Facial Plastic and Reconstructive Surgery. And then I was on faculty for 4 years and went into private practice for another 5, and then went back in and did a plastic surgery residency at the ripe old age of 44. So I was their
Wow.
oldest resident in the plastic surgery department, and it was
That
very rewarding for me.
I bet so you just love to continue to, grow and educate yourself, even though you have enough knowledge and experience to pretty much do any kind of surgery on an individual. But those are the kind of
That,
surgeons that we look for to come to, ones that just keep on learning, and um,
yes,
not letting, not getting set in their ways, and being willing to, kind of come to the new and what is new as far as procedure wise. Because I think there's so many things that change like year after year, and more and more people developing ways that things can be done with less invasively, less scarring, a number of things. So tell me about the nose. I mean, you've got, again, children with issues with the septoplasty. Is that what exactly it's called, or that's the surgery they have, is a septoplasty?
we're commonly doing septoplasty surgery on young adults, maybe starting at age 13, 14, 15. We
Okay.
don't like to operate on the septum on 12 and 11-year olds because the growth plate for the whole face is involved with the septum and the bone of the maxilla where the nose resides. So we try to let their growth pattern go ahead and develop.
Okay.
Even though we know that they have a deviation or a blockage, we like to see them get a little older, and then we can go in there
Okay,
and
that makes
fix
a
the
lot of
problem.
sense. So it's basically entering into that teenager, 13, 14, as you mentioned,
Correct,
and that's when.
correct. And
Okay.
There are exceptions, like in everything else in medicine. You can never say always or never. And yes, are there kids out there that absolutely need a septoplasty done when they're 13 or 12? Yes, if it's bad enough and they're completely blocked, you do have to go in there. And there are some studies that have been out for many years now that show if you know what you're doing, you may not disrupt the growth patterns. But by and large, unless it's really serious, we can let them grow up a little bit and not mess anything up.
Of course, of course. Okay, we have to take a quick commercial break, but when we come back, we're going to continue to learn more and even talk maybe about, some of the patients that you've been able to help. We'll be right back after this commercial break.
My primary doctor referred me to Dr. Nader because of neck pain. It was determined I had bone spurs on my neck. Surgery was performed successfully and I feel much better. I highly recommend Dr. Nader and his able staff.
I'm Dr. Remy Nader, a board-certified neurosurgeon. Let me fix your back or neck problem.
Diagnosed with a scary-sounding disease can be frightening. Imagine what it's like for your child.
There are over 7,000 rare diseases around the world affecting children.
Join me, Jessica Hatch, along with leading experts to help break down medical lingo, explain why and what their little bodies are feeling. Real faces, real stories, and expert advice.
And you can watch us on the biggest South Asian TV network in North America, NTV Houston.
Welcome back from the break. For those of you who are just tuning in, we are joined by Dr. Fred Aguilar, who is a plastic surgeon, as well as a reconstructive and ENT surgeon. So we are learning quite a bit about children that he has helped, as well as adults here in Houston and surrounding areas. So Dr. Aguilar, we were talking about the septoplasties that are done, and I was kind of going into the direction of asking you about rhinoplasties, because I know some people go in and they tend to have both, under that same, or during that same surgery. So tell me a little bit about how that plays out and, what you look for.
When a patient comes to us and says they're having trouble breathing, that usually implies that on the inside of the nose, the septum, which is fairly straight usually, on this particular person may be crooked. It's helpful if you envision a straight 2x4 as being the septum. It goes straight back, it should be straight. But maybe something happened to that 2x4. A fracture, someone hit the nose, so the 2x4 breaks, and then the growth continues and it's now crooked, or it gets warped by pressure. And so those sorts of things can happen because the septum is made up of cartilage and bone. So both of those things can change the dynamic of how it's growing. But again, a septum that needs surgery means that the nose is not working the way it's supposed to in that particular patient.
So
they can't move air through it, and that's a problem.
Sense. Yeah, and of course, and we, at my diagnostic facility do sleep studies, and that's, the common diagnosis is, issues with sleeping because they're not breathing properly, which a lot of times the sleep study will then confirm their diagnosis that they do need, surgery.
That's a very good point.
Yeah. So are these people, insurance would cover this once they can clearly diagnose that, maybe with a CT scan or sleep study? Would that be accurate?
I think that the sleep study is a really great tool for diagnosing sleep apnea. And that's a diagnosis that proves that they're blocked and can't move air. Okay. A CT scan isn't necessary because a good doctor will be able to look in the nose, sometimes with a scope, and take a picture of a crooked septum, and that's all the information you need. However, some people do get a CAT scan. But regardless, if that's all they're doing and they have the proper insurance coverage, insurance should cover a septoplasty.
Okay.
The big problem in today's insurance market, they sometimes don't reimburse anyone enough to make the surgery worthwhile. And that's what patients need to deal with sometimes, is that there are doctors who just won't do it for insurance anymore.
I see. That's really sad that it's come to that. So this is something that a 13, 14-year-old, as young as that, would be operated on, and you treat children of that age, or do you typically only, okay.
We like to wait till they're 14, 15, 16, as I said earlier. But if there's a really severe blockage, yes, we'll intervene at age 11, 12, 13, somewhere in there. Okay. And again, just to finish the topic that you started, which is to let your listeners and viewers know that a rhinoplasty implies that we're changing the shape of the external nose. If there's a hump, or the tip is deviated to one side, or if the whole thing is just leaning over to one side, that's what a rhinoplasty does. And that's not covered by insurance. And that's where plastic surgeons can really improve a nose and make a difference.
Of course. I've seen a lot of times that you'll find if people have the septum issue and they aren't happy with their nose, that they'll try and, maybe look at paying that little bit extra to have it done at that same time. But a lot of people just truly, are having major issues, and it's not about the cosmetic side, but sometimes it works out.
It does work out. It's actually, why go through two? If you're going to go to sleep for one, you might as well get it all done, so you don't have to pay for a separate setting of the operating room and the anesthesia that would be involved in a rhinoplasty.
Correct. Would you say that with children, having it approved and paying, an adequate amount is more common than with adults, or is it kind of, when benefits and things are getting checked, you're finding it to be very similar, like with, the Aetnas, the Blue Cross, these more common insurance payers? Are they, whether the child, or whether it's a younger person or older, are they still wanting to pay a certain amount?
I find that that's probably the case. And sometimes, even though the doctor may document the deviation, send them a picture, they still really want to have some studies done that just increases the cost in order for them to maybe reject even more the proposed surgery. We see a lot of that. And unfortunately, it's just the way things are right now.
Yeah. What does something like this cost if somebody, let's just say they don't have insurance for whatever reason, and they actually had just the septoplasty done? Is that something you could share with us?
When a patient has a need for a septoplasty without insurance coverage, we can sometimes do it under local anesthesia, and that really can reduce the cost because we can eliminate the anesthesia portion of the cost. However, most patients are not brave enough, especially at the age of 13, 14, 15, to do it under local. So at that age, we do have to give them a total. How much is the OR going to be for 1 hour? How much is the anesthesia going to be for 1 hour? So I would say roughly it's going to be between $3,200 total by the time you count 1 hour of OR and anesthesia, and the surgeon's fee, which may be $1,200, $1,800, or $2,500, depending.
Okay. And I guess while we're on that topic, for the surgery where like pinning of the ears back, is that something that you've done more recent and have some pricing on too, just for being that this is predominantly for children and parents tuning in that have children? If either of these are conditions of theirs, I'd love for them to just hear it firsthand without having to call around and ask all those questions.
Yeah, I think that the most important thing is it's going to be a range between $2,800 to $4,900. Depending on the expertise of the doctor and the difficulty of the ears. And ears are a very serious subject because you can't just let anybody do an ear that's sticking out, because there's really high risks associated with that. The risk of infection of the ear, the risk of artificially creating a bend that doesn't look right. The way the sutures are put in are so important. Almost 25% of the kids that have their ears pinned back, will see some recurrence of the problem and may need a revision. So all of that needs someone with a lot of experience, and you can't really mess around with that. So
Yeah,
I would say you really do need to find a plastic surgeon that's board certified, find someone that has a lot of experience with kids, and then look at the price that they're going to charge. And it's really based on their experience.
Yeah, well, I think that those are, I mean, considering what it's going to make a difference for that child, and I talk specific to children, I think that it's definitely well worth it. And I'll kind of go out there on a limb right now and even state, if any of you tuning in right now have a child with either of these conditions and are not getting the coverage from insurance, please reach out. And if Hatching for Health Foundation can be of help, we'd love to be able to connect you with Dr. Aguilar or someone that you've been researching and help get that surgery done. So I hate for money to stop someone from being able to live a normal life or not be made fun of, things like that. So just want to mention that. But as for the, I guess, technical term for the pinning the ear back, what is that called?
That is called an otoplasty, O-T-O-plasty.
Okay.
And it really means changing the shape of an ear. So it's a very common term in medical circles, but most lay people say, I need my ears pinned back. And so that's how people know it.
Yeah, okay. And tell me, so you have, I believe, 2 locations, one in the medical center and then one in Clear Lake?
Correct. One is on Benn Street in the Museum District, and the other one is in Webster, which is near NASA, near the NASA Institute,
Okay.
and right off of NASA Road 1 on Medical Center Boulevard. We have operating rooms at both of those locations, and we have excellent services for patients that need cosmetic surgery or any of the kids that we're talking about for getting their ears pinned back. And of course, septoplasties and rhinoplasties, I do a lot of those. I've lost count how many we've done over the years. But it's a great surgery, and it makes a difference in people's lives.
It really does. It really does. And I've been to both your locations, and they're beautiful. I just wanted to reiterate where they were, just in consideration for you taking the time to be here, because I know this is just something that you took time out to be a part of. I guess on any of the other things I wanted to mention, how have you seen the confidence grow, like in patients that have had, I want to go more to the pinning of the ear surgery, because sometimes the septoplasty is not cosmetically changing the look. But have you kind of had that child come back in and just seen some of the confidence that they gain?
Absolutely. We have seen children, and it's a very good point you make. Ears that stick out too far are mercilessly, these kids are really subject to a lot of kidding and peer insults, if you will, because of that. So the children that have this come in with long hair, both male and females. They cover their ear. They have no self-esteem. They have no initiative to get up and do something. They're almost cowering in their own footsteps and are afraid of their own shadow. And so after we've done this surgery, we see the girls come in with their hair pulled back in a ponytail, maybe for the first time in their lives.
Yeah.
The guys and the girls both have more confidence. They come bounding into the room because they look normal and they're not being made fun of anymore. So you talk about why plastic surgeons exist, and this is just, there's many aspects to plastic surgery, but this is one of the fun areas because we can really change the demeanor, the confidence, the self-esteem of a young kid, and that can go on and make a big difference as to how fruitful they are with their lives. It's a big deal, and I love it. I love what we do for children.
Yeah, I couldn't agree more, and I see the passion from the times that I've been able to deal with you, and or in a good way, whether we're referring patients from our own clinic. It's always been a great experience, so that'll continue to happen, and we are having to wrap up. Oh, here, let me come back. Okay.
Yeah, sorry.
No, it's okay. You made it all the way through with no coughing. So
no, I took some tea before we started.
But yeah, we've personally been able to build a relationship through referrals from my own clinic, and it's been a great experience for all the patients. So I wouldn't couldn't have, asked for a better plastic surgeon to come on and talk a little bit more about the depth of what you've done and can do, and hopefully we can connect you with some people that you can help. So I appreciate it,
Yes.
Dr. Aguilar, and I'll see you
Jessica,
soon.
thank you. Thank you for
you.
having me. It's an honor to be here. Appreciate you.
Absolutely. Thank you. And thank you, all of you Hatching for Health fans, for tuning in to another episode. We will see you right here next week at 7:30 p.m.